So let's wrap up this chapter by taking 2 slides to look at the effects of aging on our integumentary system. First off, to note that the effects of aging I'm talking about start at about age 40. Our skin is constantly growing and changing from before we're born, but the aging effects specifically that I list here are about after 40. So the first thing that's going to happen is you're going to have a decrease in the number of fibroblasts. And fibroblasts, remember, are going to be important for making our collagen and elastin. So if we have fewer of those, we're going to end up with some wrinkles. The collagen is going to decrease in number. It's going to stiffen, break, and get all disorganized. And the elastin fibers, when they get aged, they're going to lose some of their elasticity, so the ability to stretch and recoil. They're going to get thick and not be able to move as well, and also they'll start to fray a little bit, kind of like frayed hair, but very different properties, right? Hair is all keratin. So decreased number of fibroblasts, big thing. Second is we're going to have a decrease in the number of epidermal macrophages. And remember, those are important for your immune system. So if you lose those macrophages, you're going to lose your ability to fight infections and bacteria in your skin, and that's going to cause problems. We're going to have a decrease in size of the sebaceous glands. Those are the oil glands. So if you lose those oil glands, you're going to end up having dry and cracked skin. Now, if you have decreased sweating, that's going to be a problem in that you're not going to be able to control water as well, and you're going to end up having heat stroke or a higher propensity for heat stroke. And you'll see that happens a lot in the elderly because they're unable to sweat so much. Also, because you've got the dry, cracked skin, that's going to allow it to have more bacterial infections, more sites for those bacteria to enter your skin. So a decrease in size in those sebaceous glands will cause a lot of different types of problems that way. We'll have a decreased number of functional melanocytes. So that's why people start to get gray when they get older. It's the melanocytes that are causing the melanin in the hair. That's the pigment. So if you lose those melanocytes, you're going to lose your gray hair. And actually hair in that cortical region, it's actually filled with air. And that's why it looks really clear. Number 5 is we have a decrease in growth of the hair and the nails. So it's not going to be going through that mitotic division quite so quickly. And lastly, the nails also become more brittle with age, and they'll tend to chip and crack, and that can cause problems as well. So a lot of things going on with the integumentary system. The good news is that we can treat some of that, or at least try to manage some of the aging effects of the skin. Now, what I have on here is just a little thing I pulled off the internet. It's not anything that I'm endorsing, treating your skin with any of these things, but it's kind of fun to look at to see what people are promoting out there. Again, this is from the top 10 home remedies, so I don't know how well backed up all of this is, but I'll compare some of these to, on the left, we're going to go through some of our scientific-y type treatments that we can use for the skin. So first off is topical products. And these topical products, things that you rub on your skin, often are trying to bleach out some of those marks, some of those age spots or liver spots that we talked about earlier. That's an accumulation of melanin. We can do microderm abrasion. In that, what they do is they take rough rocks or like little crystals to basically scrape off the dead layers of the epidermis, and then they kind of vacuum them off and they get rid of all of that shedding epidermis so that more of just the clean tissue is there. We can use chemical peels, and in those they're using mild acid. So actually things like here we got lemon juice on here, which is very acidic, and that's going to help to peel off some of that outer layer of epidermis. It also helps to change that pH level in the skin to reduce bacterial growth and different algae and things that may be causing inflammation and problems in the skin. They can do laser surfacing, where they actually use a laser to clear out some of the small fine vessels that may be showing through the skin near the surface. And they can use a lot of dermal fillers. So injections of things like collagen, which we know is getting lost, or hyaluronic acid, and we talked about that being a lubricating acid earlier. And that all helps to plump up the skin or to smooth out the wrinkles, and to return some of that stuff that may have been lost with aging. You can actually do fat transplants, where they take fatty tissue from certain areas of your body and bring it to other places in your skin. Often they'll do it around the eyes to replace some of that, to eliminate some of the wrinkles in those areas. Botox, or botulinum toxin, is an injection that's used, and what that does is it actually deadens the nerves that are going to some of the muscles of the skin here. So allow those muscles, force them to relax so that they're not causing a crumpy frown face. And often you'll see that in the corrugator or procerus muscles, which you'll learn about in a little while, up in the forehead or around the eyes. I actually had a friend when I went to business school who was an ER doctor, and he was looking to do some things on the side, and he ended up creating a small business, which ended up doing him pretty well, I think, where he had Botox parties for people, and he would go meet people in their houses, have a group of about 4 to 6, often middle-aged women or so, that wanted to get Botox treatments done, and he would inject them all there. It takes a few hours to see the results from that, but it certainly can be a temporary type fix. Usually it lasts several months. And the last one on here is a facelift, obviously a little bit more invasive. Couple of different techniques for that. They can use radio frequency emissions to tighten or adjust the skin. And also they could do, surgical is what you normally hear of as a facelift, where they make an incision maybe up here towards the hairline, or they can even do it within the eyelids, remove some of that skin and then pull it up tight to tighten out the skin and remove some of those wrinkles. And it just depends on how that whole thing heals, on whether it's going to be a good job or not. So that's a facelift. Those are some ways that we can manage our drying, aging skin, and certainly putting all these supplements on it are other ways of doing that as well. That wraps up our chapter. Hope you enjoyed our integument. And next we'll be moving on to the bone chapter, chapter 6.